and be deeply concerned that a quarter of those who have died passed away in the last week. We mourn the loss of each and every one of those who have passed away, including some who have been in leadership positions in our country, such as Queen Noloyiso Sandile of the Amakgakgabe and Northwest MEC Gordon Kekakilwe. Our thoughts and prayers are with all their families at this time of extraordinary grief. We extend our best wishes for a speedy recovery to 3 of our premiers who have been tested positive for coronavirus: Premier Allen Winde of the Western Cape, Premier David Makura of Gauteng, and Premier Job Mokgoro of Northwest. But we also extend our best wishes to many other South Africans who are currently infected. As a country, we are not alone in our fight against coronavirus. Most other countries around the world are engaged in exactly the same struggle as we are. More than 500,000 people have died from COVID-19 across the world, and the total number of confirmed cases across the world has now grown rapidly to more than 12.7 million. While the surge in infections has been expected, the force and the speed with which it has progressed has quite understandably caused a great deal of concern amongst us. Many of us are fearful of the danger this presents to ourselves and to our families. Like the massive cold fronts that sweep into the hinterland of our country from the South Atlantic at this time of year, there are a few parts of the country that will remain untouched by coronavirus. The coronavirus storm is far fiercer and much more destructive than any that we have known before. It is stretching our resources as we speak, but it is also stretching our resolve to their very limits. The surge of infections that our experts and scientists predicted over 3 months ago has now arrived. It started in the Western Cape and is now underway in the Eastern Cape and in Gauteng. Gauteng is fast approaching 100,000 confirmed cases. The Eastern Cape has passed 50,000 cases, and although the rate of transmission has slowed in the Western Cape, it will soon have 80,000 cases itself. According to current projections, each of our provinces will reach the peak of infections at different times between the end of July and late September. Yet while infections rise exponentially, it is important to note that our case fatality rate of 1.5% is amongst the lowest in the world. This is compared to a global average case fatality rate of 4.4%. We owe the relatively low number of deaths in our country to the experience, to the dedication of our health professionals, and the urgent measures we have taken to build the capacity of our health system, which in itself faced a number of its own inherent challenges before COVID-19. And of course, the measures we've taken are not perfect. We must remember that the most important measure of success is the number of lives that we save. More than 134,000 South Africans have recovered from the coronavirus. Many of those who have recovered took personal responsibility for their health and the health of others by self-isolating or presenting themselves to quarantine facilities. Even as most of our people have taken action to prevent the spread of the virus by embarking on a number of measures that we've already spoken about, there are others who have not done so. There are some amongst us who continue to ignore the regulations that have been passed to combat the disease. They also act without any responsibility to respect and protect others. In the midst of our national effort to fight against this virus, there are a number of people who have taken to organizing parties, who have drinking sprees, and some who walk around in crowded spaces without the protection of masks. Then there are some of our people who see no problem attending funerals where the number of the people in attendance exceed the number of 50 that has been set out in regulations. In some cases, some people go to funerals where more than 1,000 people are in attendance. This is how the virus is spread, through carelessness and through recklessness. It is concerning that many are downplaying the seriousness of this virus, despite all evidence to the contrary and what we have cautioned about on numerous occasions. We now know of several tragic instances where people who have organized or attended social gatherings, including what people call after tears, after funerals, including gatherings with family, have contracted the virus and have died. In the midst of such a pandemic, getting into a taxi without a face mask, gathering to meet friends, attending parties, or even visiting family can too easily spread the virus and cost lives. This may be a disease that is caused by a virus, but it is spread by human conduct and human behavior. We're in the midst of a deadly pandemic, and we must act accordingly, in line with the prevention measures that we continue to speak about and to communicate. We are all required to be responsible. We are required to be careful and compassionate. The truth is that we are not helpless in the face of this storm. Scientists and other scenario planners have presented us with models that project that South Africa may have between 40 to 50,000 deaths before the end of this year. We must make it our single most important task to prove these projections wrong. Through our own actions, as individuals, as families, as communities, we can and we must change the course of this pandemic in our country. We are by now all familiar with what we need to do to protect ourselves and others from infection. We need to be aware that we must wear a cloth mask that covers our nose and mouth whenever we leave home. Some people complain that they don't have cloth masks. But seriously, a cloth mask is not something that's difficult to get. Even your t-shirt, even your scarf, even a piece of clothing can be put over your nose and your mouth. We must continue to regularly wash our hands with soap and water or sanitizer. We must continue to clean and sanitize all surfaces in all public spaces. Most importantly, we must keep a safe distance of at least 2 meters from other people. There is now emerging evidence that the virus may also be carried in tiny particles in the air in places that are crowded, places that are closed, or places that have poor air ventilation or circulation. For this reason, we must immediately improve the indoor environment of public spaces where the risk of infection is greatest.